Kia ora koutou katoa, ngā mihi nui kia koutou. Welcome to our Waitakere Health and Community Health Services Zoom. For December, we've got to the end of the year, which seems to have gone very quickly. I'm just going to do our opening karakia before we start. So, kia ora te marino, kia whakapapa paunama te moana, he huarahi mā tātou I te rangi nei, aroha atu, aroha mai, tātou ia tātou katoa, hui e, tāhiki e. May peace be widespread, may the sea be like greenstone, a pathway for us all this day. Let us show respect for each other, for one another, bind us all together. So you may have seen a little note, a little blue hand on the screen, and so hopefully all of you know how to raise your hand. So when it comes to the community health services provider presentations, I'll ask each sector to put their hands up on their screen, the virtual hands, so that you come to the top, and then we can everybody can see that you're next to speak. Thanks all for being here today. So just want to acknowledge Deputy Chair, I'm Chair of Waitakere Health Link. Our Deputy here is Kate Lindley. We have Samuel Cho here, who is on our board, and also our Consumer Council rep. Didn't see any other members, but Zari Fazalnia is here too, just seen her come on. So today we're very privileged to have a guest speaker, Danny Wu. His title is quite long, but it kind of describes what he does. Regional Wayfinder Commissioning, which is the word for the old funding and planning, commissioning Northern Region Te Whatu Ora Health, New Zealand. And we really appreciate you coming, because as we know, it's been, what, 1.5 years since Te Whatu Ora started, and we're still kind of learning our way as well. We're wayfinding as well as a community, and without any elected people to speak to, we've had to find connections within the hospital, and we're very lucky to have a good connection with Paula Seymour, who is our GM Waitakere Hospital. So without further ado, I'll introduce you, Danny, and hand over to you, and you're going to share your screen to talk about how will the new health system benefit NGOs and the wider community of West Auckland. Kia ora.
Kia ora, Linda. Thank you for the opportunity to talk to the NGO forum today. Just a bit about myself to start with. I'm a pharmacist by training, and so I've been working in the health sector in both clinical and management roles now for probably close to 40 years. And so I have worked as a pharmacist in both hospital and community, but probably for the last at least 30 years in management roles across the health system. More recently, I was the National Program Manager for Primary and Community Care at the Ministry. And so things like the establishment of PHOs, the introduction of capitation, all brought in under my watch. And in the last 10 years, I have been working at Middlemore in operational roles, where I was General Manager for Surgery, but also doing a number of other things at Middlemore. That's just a bit about myself. Just to acknowledge the NGOs and the broader provider sector for your patience, why the health system's being restructured. We've lost a fair bit of time in terms of how long this restructure has taken. It's taken a lot longer than we had anticipated, and I'll talk to some of that today. But just to thank you for your patience and people's resilience to what's going on, changes in your people contacts, being unclear, not just around what Te Whatu Ora is doing, but also the broader government now that we've got a new government. So I'll just change and share my screen. So today I just wanted to talk through some of the changes that we've made in the health system and what that means for people like myself in commissioning. My title is Regional Wayfinder, and it essentially means we're trying to change the way we operate as a health system. Traditionally, I would have been called a regional director, but we're not wanting to give the impression that we're trying to enforce things from the top and trying to work much more closely with our communities. Hence the nomenclature around wayfinding. We realise there are significant issues in our system and needing to find that pathway through them. So what is it the new health system is going to achieve? And some key words here around a national system that makes consistent change over time to achieve better health outcomes, address the ongoing problems that I just mentioned, and provide services that are nationally planned, regionally delivered, and locally tailored. And some people have misunderstood what consistent change means. We are not trying to standardize and make everything the same for the sake of it. There is warranted change that we want to, warranted differences that we need to continue. And you would have seen some of the stuff coming out of the new coalition government about things being based on need. And so when we know that there are large differences in need across the country, and that's some of the warranted differences that we need to change over time, but make that some of that consistent across the country. So what are we doing in high deprivation areas in the northern region, as well as in the central and in the South Island? And the national system is important because that changes the way Te Whatu behaves. And so one of the first things we've done in the restructure is we have amalgamated 29 different organisations. And when you think about 29 organisations, they come with different systems, different processes. Even a lot of our hospital systems have taken a fair bit of work to get them to talk to each other. And so that's a lot of the background work that's been done to pull together a national system. We talk about 5 system shifts. And the first one being providing one system of care, being able to network both our public and private sectors so that we join things up and coordinate across the wider system. So at the moment, we're all aware that people have got huge silos to jump through, huge hoops to jump through when they try to transition between specialist services back to the community, to NGOs, and go up and down across our system. Create a platform for innovation and change. We realise that there are pockets of innovation that could be much more easily spread and scaled up across the country. Collaborating with our workforce to grow and support how we develop both our rural and our urban workforce. And everyone is well aware of the issues of the impact of the last 2 or 3 years on our workforce capacity. Supporting our communities by partnering in localities with the iwi Māori partnership boards, government agencies, as well as local governments to build healthy environments and enable people to thrive. I'm a clinician by training. If I want to treat hypertension, it's all too easy for us to throw drugs at a problem and we can deal with hypertension that way. But a lot of the issues in health are with our socioeconomic determinants. And health alone can't deal with that. So we do need to work with our communities, with other agencies, and also with central and local government. And then working collaboratively across those agencies, including Whaikaha, and in our own structure within commissioning, we have disability people within our own teams. So how has Te Whatu Ora reorganised itself? How have we merged the 29 organisations? So we know we've set up Te Aka Whaiora as a partner organisation, as the Māori Health Authority. And Te Whatu Ora itself has got 5 different delivery teams. Those 5 there around public health, commissioning, hospital and specialists, Pacific, and our service improvement and innovation teams. And separate to those 5 delivery teams, we have our clinical leadership team and the enabling teams. These are people who do HR, technology, infrastructure. And the way the government funds Te Whatu Ora is we now have 2 main appropriations of funding. Hospital and specialists, that funds the hospital services, $12.7 billion, and commissioning, the $8.1 billion. And the reason for that, well, one of the benefits of that is it does enable commission to focus on funding for the needs of our communities, whereas previously we would have kept a little surplus to fund the hospital deficits. And many of you will have noticed that the hospitals have been quite focused on making sure that they can live within their own funding base. And so that's the reason that they have to live within that $12.7 billion. This busy slide is not to go through the detail, but to just illustrate a few things. On the right-hand side of the slide, these are within the $8 billion of commissioning funding. Large parts of it go to primary care, $1.5 billion. Another large part of it, another $1.5 billion, goes to the residential aged care sector. On the right-hand side, $678 million goes into community pharmacy, paying for drugs, and smaller amounts to laboratory services, maternity, and the mental health sector. On the right-hand side of this picture, this is what we call our commissioning operating model, how we do things, and trying to make sure that the needs of our community and whānau, taking into account how providers operate, what their skill sets are, what their expertise is, and also what our partner networks are, a lot of our volunteer sector, community stakeholders, and how we design our systems of care, taking into account what the needs of this group are, how we agree health and wellbeing plans, which includes what the government's needs are as well. So we're trying to balance the top-down and bottom-up stuff. We execute our investment decisions in the form of contracts. And as we brought Te Whatu Ora into one organisation, we've realised that actually we've uncovered 10,000 contracts. And with 10,000 contracts, there's 10,000 ways of doing things. And so hugely complex in terms of funding frameworks, service descriptions, standards, how we monitor. We've got multiple reports that come through to us now that all measure different things. And so there's clearly a need to simplify a lot of that stuff. And then, are we actually delivering what the community needs? Are those services making any difference? And so we need to monitor those outcomes. And part of our commissioning framework is if services are not providing the benefits that we want or that the community needs, then we need to rethink that. Then we need to reinvest that money. And so that's what a commissioning operating model is when people talk about it in that language. As a single organization, we think of operating as a team of teams. Previously, we may have had self-contained teams within planning and funding. So planning and funding would have had its own analysts, it would have had its own finance people, it would have had its own Maori Health team and Pacific Health team. But we don't have that luxury anymore. So we operate as a team of teams. I talked about the 5 different delivery teams. And so within those delivery teams and also within the enabling teams, we share a lot of those staff with the commissioning team. So that's what we mean by a team of teams. Within commissioning, all the delivery teams have set up as a regional structure. And so within commissioning, we have this regional leadership team, which includes myself. And you saw in our operating model, we talked about system design and doing so. System design at a higher level, we'll look at the system once and do that nationally, but informed by our regional people. So this is how we bring the practical aspect of, can we do this or can't we do this? Funding and investment informs that. You know, what are the benefits of this in 10 years? If we invest $10 million in this, what would be the benefit of that over 10 years? Informed by our Maori Health Director. We have a National Director of Commissioning. Like I said, we have our clinical leadership. In the path smoothing, that's about how do we work as a team of teams, not just within commissioning, but also across Te Aka Whaiora and within Te Whatu Ora. I'll just quickly jump to the end of this. And so our national directors of Te Aka Whaiora and Te Whatu Ora report through to our respective executive leadership teams. We each have our own chief executives and our own board of directors. And this team of teams here is what I described earlier around commissioning, working with public health, National Public Health Service, hospital and specialist services, service improvement and innovation, and the enablers. And so how do we get the technology change we want across the system? How do we modernize the health system so that we can all talk to each other? We collect the right information, that information is available to everyone, and also we can share that with our communities. This is the, whoops, let's go back a slide. This is the commissioning leadership team. And I'll share these slides so that people got names to talk to if you need to contact other people. So I'm the regional wayfinder for the northern region, and I've got colleagues across Te Manuataki, Central, and Te Waipunamu. And we regularly work together on both the strategic direction, but also largely making sure that we drive our implementation in a consistent way across all 4 regions, and that our national colleagues are aware of what we're doing, but also what we're getting out of it. Are we achieving what we had anticipated? This picture is an important picture in terms of it shows the boundaries for the 4 regions that the regional wayfinders are responsible for. But it talks to the regional directors of Te Aka Whaiora, as well as the Iwi Māori Partnership Board regions. And so for the northern region, Tracy Tahuia is the regional director for the northern region for Te Aka Whaiora. And we have 2 IMPBs in the northern region, Te Taumata Hauora o Te Kahu o Tainui in the far north. That's their boundary is from Ngāti Whātua in central Auckland upwards. And the second IMPB is Ngā Pau Hauora o Tamaki Makaurau. And so that's basically South Auckland, the county's boundary. And I've shown the others there for your interest. These are my national colleagues. The director of localities has now been appointed. That's Carly Ormerod. And these photos are from the previous slide, so we'll share that with you later on. So what does that actually mean for our communities and in particular West Auckland? So localities, I said, we want to bring through the community voice and whānau voice. We need to understand what our community needs are, not just in health, but more holistically. And so communities are being organised as localities. We do have a locality structure within both the national commissioning team and also across the regions. And we think of that as a way of working. So we bring the bottom up. And so we understand not just what the community's needs are, but also their priorities. And as I talk to a lot of community groups, they voice to me their issues around housing, issues around the accessibility of alcohol, community violence, those sorts of issues, as well as their health needs. And a lot of it is about how our system operates. The fact that people need to repeat their story to multiple providers. Everyone thinks that we share their clinical information. So there's all that stuff coming through. And so when I talk about, what do we need to do to modernize our digital systems, a lot of that is about how do we make it easy to share information with the right people so people are authorized to be able to access that. But also, how do we share that performance data with our communities? Are we improving the health of our communities? The iwi Māori Partnership Boards, they're legislated for, and they've got a very distinct role around bringing through the community voice and their priorities to Te Whatu Ora. They also have a governance function. And so I provide information back up to the IMPBs around what are we doing to address equity, how are we progressing on that. Te Whatu Ora will continue as the Commissioner of Services for localities. We won't be setting up parallel commissioning structures. What we've found over the years is the more commissioners we have, the more replication and duplication we have across the system, particularly around having different pockets of information that are kept in little silos that people find difficult to share information. With those different silos, different definitions, measuring different things, all that sort of thing. So commissioning has a locality team that we're currently recruiting to support the localities to plan, to support the commissioning of those services, engaging with those providers, shaping those services into what the communities actually need in terms of delivery, important function around coordination and integration. How do providers on the ground work with each other? What's the glue that holds those providers together? Are we channeling funding to the right places? And how are we working with our intersectoral partners if communities are saying, actually, we're finding it really hard to travel in the far north because the roads are still closed, because of the slips, or because there are potholes everywhere, and therefore it's taking an extra hour to get to Whangarei Hospital for the outpatient appointments, and people can't afford the petrol. How are we addressing left hand and right hands talking to each other when I've got multiple providers in, say, the immunisation space? And are we trying to target the same whānau? Who's providing the information on who's missed out on world child checks or immunisation? And so this is local coordination and integration that we're keen to get on top of. We are developing a regional health and wellbeing plan that is informed by both the IMPBs and our localities. The plan itself, it's the first draft is just a working document. It's a collection of what's going on at the moment, not trying to describe everything that's going on in our system, but what are the big ticket items that would transform our sector and deal with how we might want to transform health in terms of those 5 system shifts that I described earlier. We have a regional integration team across all 4 regions. It's co-chaired by myself and Tracy Tahuia from Te Aka Waiora. And that regional integration team consists of the regional directors of the delivery teams. And so our role is around overseeing the delivery of that regional plan, the system integration I described, but also our regional performance. And as I said before, we do have Te Aka Waiora, our IMPBs having a governance role as well as our own board, but also reporting back down into our localities around how we're performing across the system. All of us have just received the new coalition government's priorities, and we've yet to have those detailed discussions with incoming ministers on what exactly does that mean. A lot of it is to do with what was in their previous manifestos. But in terms of localities, there was something in the National Party manifesto on localities, and we're yet to have a detailed conversation with Minister Reti on exactly what his thoughts are on that. And we will have local relationships with the system integration team and the locality team. So the system integration team, those are people who will be designing health services. And so health services framed around life courses, starting well, living well, mentally well, aging well, and also with rural. And the locality teams, they'll be looking to integrate health and social services. So they'll start to have those much more local discussions with local providers, local governments, and working with me with Kāinga Ora, Airanga Tamariki, the police, MSD. So we've already got some work underway, not applicable in West Auckland yet, but in South Auckland, we have a social investment board that we've got a number of initiatives running across a number of agencies. And a lot of that is about how we integrate health and social services to meet the priorities of a local community. And so just in summary, for commissioning, we've got 3 things in mind around design, embedding, and simplifying. So designing the major systems of care. The new government has said to us, look, we want to continue with PHOs, primary health organisations, and we will have that discussion with Minister Reti and the associate ministers on exactly what that means in practice. But we realise that for a lot of our major systems of care, particularly around those big ticket funding areas I talked about, around residential care, mental health, primary health care, we realise that the fundamental models in those areas are quite old now, and they're probably not fit for purpose. So we're wanting to really relook at what we fund and how we fund them. And we work with our partner organisations. And then there's, because we brought 29 organisations together, there's quite a bit of work I've got to do around our team roles and our team culture and how we work as a team of teams across not just Te Whatu Ora, but also with Te Akawhai Ora. Embedding, using localities as a way of working. So rather than the top-down stuff and telling localities how the world's going to be, how we get that better balance of bottom-up, top-down. We'll always have some top-down because governments will always have their own priorities. But how we work across the system with our clinical leadership and with our communities on implementing health and social services across our region. And simplifying stuff. How do we make it easy for our communities to engage with us? And so, like I said, we've got a locality structure, and we will be appointing senior locality managers to engage with localities, as well as locality development advisors working with localities around how do we bring these services back into your communities? How do the providers shape those services to meet individual community needs? Because a lot of those providers are nationally based and not necessarily locally based. Simplifying our contracts, like I said, redesigning some of those contracts, but also simplifying the arrangements. We've got 10,000 contracts, but there are providers there that have got several hundred contracts. And so we can simplify some of that, as well as simplifying the reporting requirements within them, bringing about some consistency nationally around what some of those reporting requirements are, and having some consistent definitions for them. And that way it'll enable us to simplify some of our electronic systems. And for our communities, how do we simplify our health system? How do we make it less complex for people to navigate? So I'm going to stop there and just thank you for your patience, and open for questions.
Thank you, Danny. I feel a bit rude just calling you Danny when I don't know you, but I don't want to call you Mr. Wu. But I hope that's okay. So thank you very much. I'm going to take some questions, and I see I've got one already, but I'll ask that later. But I see Trish from Hospice West Auckland has raised her hand. Trish, have you got a question?
Kia ora. Thank you, Danny. Danny, I think that we're all interested to know what the locality's structure is. You've referred to that a couple of times.
Trish, your sound is really bad.
Okay, hang on. Is that better?
It might be my internet connection. You carry on. Yes, thank you.
I guess we're interested to know about the locality structure. You know, we're all out in the community. We all wish to be partnering and delivering and represented, and don't want to be left behind. And so that's really important to us to understand, please.
Yeah, at the moment, we've only got 2 locality structures stood up in the northern region. That's the Taikorohi region, the Taikorohi locality in the far north, and Otara Paftaui. Nothing stood up yet in West Auckland. I mentioned before that we're waiting to talk to Minister Reti about localities and how he sees localities working in terms of the context of not just the coalition agreements, but also his language around an ongoing role for things like PHOs, his service priorities in terms of how he wants to fund certain services. He's talked a lot about general practice, being a general practitioner. And we see primary care as much broader than general practice, of course, and wanting to incorporate the role of our PHOs. So in terms of West Auckland, there is no locality structure just yet. So you're not missing out on anything at the moment. We've just been maintaining services for now until we've had that conversation. I did mention senior locality managers and locality development advisors. Those are for our own internal structure. And so those are the people that will be engaging with locality partners in the future. Not sure that answers your question, but there's nothing stood up in West Auckland.
Yeah, thank you, Danny.
Yeah, thank you.
We did have a bit of a flurry about a year and a half ago with our local iwi Māori partnership board sort of sending out a pānui for people to get together, etc. And we had a few meetings and then nothing more. But it was a little bit concerning because we were told that unless the NGOs or providers were half governed or owned by Māori, they wouldn't get any funding. So I hope that is not the case.
No, that would be news to me.
I know that's good, but also the other question that comes on the back of that, and it really is around, because I mean we're all concerned about how our community voice gets through, because we had a DHB before. Waitakere Healthlink have been working for over 21 years on community voice, but I think what probably we would like to know as a group is how does Waitakere Healthlink and our NGOs feed into the IMPB and the localities once. And we also know that the locality isn't exactly described yet either. So what do you think the mechanism will be for us to be able to have a voice into that as local providers?
Yeah, why don't I describe to you how other localities around the country have coalesced? And
You've frozen. Oh, here we go.
Yeah. So localities have been, it's been a bit of a learning journey. And so most localities have had a group stood up.
Sorry, you froze a bit there. You might have to start again. Sorry.
Okay. Most localities have been stood up, having defined boundaries, and a group has led the charge around engaging with that community, identifying what its needs are, what its priorities are, but also better understanding what makes up that community. Not just around its demography, but also around its provider networks, its issues around the environment, housing, and so all those sort of social determinants. And so those lead groups have brought together a lot of partner organisations. And so that's how I would expect West Auckland to evolve once we've got boundaries confirmed.
I think our internet's a little bit unstable at this end, but I'm not sure if you're finished here. Oh, yes, I see something. There was another question, and I saw the hand go up, but now I can't find it. Can that person, is it from Changing Minds?
Jody.
Jody.
Yeah,
Thank
sorry.
you. Thank you, Jody.
It's okay. You half asked my question, so I thought, oh, maybe I'll pop it down, but maybe now I've got the opportunity.
Yeah.
Thank you so much, Jenny, for talking through all of this. And I think I heard you speak at the regional network meeting a few months ago, and it looks like quite a lot has changed, and that time as in moved along, which is really encouraging. I guess it was more an observation, and it's kind of picking up off what Linda said, but for me, meaningful transformation is really about hearing the voices of our community and engaging with lived experience to transform what services and planning and implementation looks like. And that's backed, I suppose, by things like the Code of Expectations, which sort of mandates that sort of co-design process. So I guess what my question was, which I'm not sure if you can answer, but if you can't, if you could take this under your hat, is really looking for opportunities to be engaged, so that that lived experience voice is front and center, because I noted in your presentation there was a lot of really wonderful information, but the lived experience element wasn't necessarily a priority. So this is a half question, half statement. You know, sorry, it's not very specific, but I guess that was the point I was wanting to get across.
Yeah, thanks, Jody. People who know me well will realise that I'm big on lived experience. And so, yeah, when I talk about listening to the whānau voice, listening to the community voice, that's exactly what I'm talking about. I don't necessarily mean exclusively talking to providers.
Yeah.
And so, yeah, you'll hear me talk about whānau voice, community voice, stakeholders, providers, and so I'd separate them as distinct groups.
Thank you. And I think, I mean, we do hear a lot about the South, and there is a lot of need in South Auckland. In West Auckland, we've very much over the years been very vocal, and we work collaboratively, we talk together, things like that. And I think probably one of the big questions we have is how will you talked about locality planning, and a lot of that is around you know, making sure that we meet the needs of our Māori community. That's really, really important. But I think it's like, how will you connect with all of our
Did Linda cut off?
Yeah.
Yeah.
still at the moment, but
Linda, we lost you, and we've lost your visual and your sound.
I think there was another question in the chat just while Linda's frozen. I think from Danny. Yeah.
What happens to the chat stuff?
Yeah. Sorry, keep going. I dropped off, so you're probably answering. So carry on.
No, I'm not answering. We didn't actually hear your question.
Oh, sorry. Yes. Well, we've got a bit of. We need to tell you that at Waitakere Hospital, the internet's not good. So anyway, really the question was how will until we have locality planning, how will that community voice be heard? Because we don't know how long that will be. And also you've got a consumer council, and even our representative on the consumer council is saying we don't quite know what's happening there. We think when we talk about regional plans, our region now is going to be quite extensive. It goes right up to Cape Reinga. How are things like regional plans, when it's very wide, big population, very different needs, going to incorporate the needs of the sort of, I would call, districts, where they kind of had even smaller parts of district health boards? I suppose that's the question we kind of wanting to understand, because I think we feel a little bit of a vacuum at the moment. And it's not a criticism, because we absolutely know there's a lot to do, but we have, even at amalgamation with our council, felt that the West has been a little bit left out, and I think that's probably a fear we all have around the health amalgamations as well.
Yeah, that's a fair observation, Linda, that one of my earlier slides I talked about regionally delivered and locally tailored. And this is about how do we better understand the needs within what I call sub-localities. And you know, none of us, clearly West Auckland is not homogenous, and there are pockets of need that we need to call out. And so that's exactly what our locality managers will be engaging with local communities about. And so as soon as we got those people on board, we've started to get people on board now. I've got 1 of 6 recruited at the moment. And once those people are on board, you know, they'll be going out to those local networks, engaging with networks that already exist. And I'm not looking to redesign existing relationships. Those already exist, and we don't need to recreate them. And like I said before, a lot of this is how do we communicate with each other, but also engage in the right way and get to the nub of the issues, because all too often we skirt around the issues and don't talk about the elephants in the room, and therefore it'll get lost in translation.
Yeah, thank you.
I'm mindful that there are intractable issues in our system that are going to take a wee while to get through.
And thank you. And I think we're going to
try and answer one of the questions in the chat around what happens to Te Aka Whauora. And I think the safe answer is I don't know yet. We're letting the government have its own conversation with key people around the country now that they've indicated they want to disestablish Te Aka Whauora. Because the question is, what happens to the staff? I think a number of options have been framed up for the government, and so I need to give them some space to consider that and give us some direction.
Right, thank you. We've come to kind of the end of the allocated time, but I want to thank you on behalf of us all for taking the time. I mean, it's a big job you've got along with your teams, and thank you so much for taking time out to come and talk to us. We really appreciate it, and hopefully we'll just keep in the loop. And that's like somebody's going. Keep in the loop, and hopefully we'll have some of your team coming to talk to us as a network. So thank you so much, and you're going to share that presentation with Tracy, and Tracy will send that out to everybody. Thank you so much.
Are you happy if I just continue to listen in and see?
Oh, absolutely, absolutely. So and you'll get a sense of some of our providers here, some local and some national, but who work in our area. So one of our Anna Gunderson has to leave. She's been called out quickly. So what we're going to go on to now is our presentations from our NGOs. So what I'd like you to do is everybody under the long-term conditions, if you can pop your virtual hand up, that means you'll come to the top of the screen, which is really helpful. And we're starting off with Kate Fayoso from Asthma New Zealand. You here, Kate?
Good morning. Sorry, I don't have any video today.
That's right, no problem. And just for everybody, it's 1.5 minutes, and Tracy's ruthless at 1.5 minutes. All right?
Perfect.
Over to you.
Awesome. Yeah, thank you for having me this morning. So yes, my name is Katie. I'm a nurse educator at Asthma New Zealand. So we do a lot within the community. We've got 6 nurses in Auckland, 2 in Wellington and 1 in Rotorua. And we see people nationally. So for asthma education, COPD education, we even do a bit of bronchiectasis as well. So we are a free service providing education to both patients and health professionals as well. We run courses in person and online, and anyone can refer themselves for education. They can either self-refer or the health professional can do that for them via our website, which is I'll pop into the comment section shortly. But yeah, we're really excited to sort of be beginning next year. We're starting a new chapter where we are going to be getting further reach to more people, hopefully, through our new sort of database system. And yeah, we just invite you all to go check out our website. We've got some incredible resources on there on asthma. We know that there's an asthma attack every 2.5 minutes in New Zealand. It's outrageous and unacceptable. And we're still seeing about 100 people die a year from asthma, and completely preventable. So yeah, really, really passionate about this. So please do jump on our website to see how we can support you and all your patients and their whānau. Yeah, really keen to sort of get on board with other health professionals or community workers in this forum, see how we can collaborate possibly in the future as well. So I'll pop my details in the comment section, and please don't hesitate to get in touch. Thank you.
Kia ora, Katie. Right, we'll move next to Nicola Brenton from Dementia Auckland. Kia ora, Nicola.
Kia ora, everybody. My name's Nicola. I'm a dementia advisor based in Henderson. Dementia Auckland provides services to people living with dementia as well as their supporters. So we have 8 dementia advisors across the broader Auckland area. We provide home visits. We meet with whānau. We offer strategies, validations, support. We have carer education courses to offer online as well as in person. We offer master classes to supporters as well as to health professionals. We also provide support groups. So the dementia advisors all have 2, 3, 4, or 5 support groups running a month across the area. So if anybody knows of anybody who has a person in their world living with dementia who would like to get some support, please go onto our website, Dementia Auckland. We've got self-referral systems in there as well as health professional referrals. And yeah, we'd love to talk to you. Kia ora.
Hi, Nicola. So next was Anna Gunderson, and she's had to go. So I'll quickly read out what she's written. Aroha mai, I've been called into an urgent family group conference, but I wanted to say kia ora koutou. I work here in West Auckland, and Tamaki Wide is the fetal alcohol syndrome, I'm not sure if it's diagnosis disorder navigator. Yes, my mahi focuses on whānau, hauora, and education, plus training and support for the professional teams around the individuals with FASD, diagnosed or undiagnosed. Fetal alcohol is a national health and disability issue. Please feel free to reach out to Anna Gunderson, and she's popped her email there on the sidebar. Thank you. So next is Trish Fleming from Hospice West Auckland. Welcome, Trish, again.
Kia ora koutou, lovely to see everybody. I just want to say, I'm going to pop in the chat the invitation to tomorrow night's networking event. I know that several of you are coming, but I'd love to see several more of you. We're steadily working on building this connected community of care in West Auckland for those involved right across the whole spectrum of end-of-life care providers, so encompassing healthcare, social care, Māori partnerships, cultural partnerships, faith-based culture partnerships, tertiary institutions. So any organisation involved right across that spectrum, caring for people with long-term conditions who have a limited life expectancy. Yeah, so our speakers tomorrow night at that event will be Rosetta Fuenwano from the Faux Local Board, talking about their local board plan for older adults and how they are working with us at Hospice, and also Alola from the Special Needs Library Service, talking about how they are working hard to target vulnerable populations and get literacy and resources in there. So come join this connected community of people who want to contribute to better end-of-life care in West Auckland. Thanks so much.
Right, Trish. So next is Independent Living Charitable Trust. Richard, welcome, Richard.
Hi, Independent Living. We offer disability information service, and we have 3 stores selling assistive technology. But I've waited 40 years to say this, so hang on. If you have a problem, and if no one else can help you, and if you can find me, then maybe you can hire me. Sorry, I took that from the A-team, just so you know how old I am. Trish, I'll see you tomorrow night. Have a good Christmas, everyone.
Thanks, Richard. Right, next is Vanessa Atkinson from ME Support. Welcome, Vanessa. Have we got Vanessa? Oh, let's have a look. Doesn't look like it. All right, so we'll then go to Penelope from MS Auckland. Welcome, Penelope.
Morena, I'm Penelope. I'm a community advisor with MS Auckland. I work in West Auckland and in the Rodney areas. MS Auckland offers many services to help people with multiple sclerosis to live well. Our team of community advisors provide support to people living with MS, as well as to all people affected by MS, so including family members, employers, friends, and caregivers as well. We also support health professionals involved with treating MS patients. As a community advisor team, we cover the whole Auckland region. We provide support, information, advice, and lately lots and lots of referrals too. We play a role in education and connecting people. We have several support groups operating throughout Auckland, and in West Auckland we have one in Henderson and also in Kumeu, as well as online groups too. We have a formal one-on-one peer support program with trained volunteers. We also provide members with a monthly e-newsletter. We also have a quarterly magazine called Multiple News. Got one up here, so it's online and also in print format too. Our website has lots of webinars that are really great for members, but also for health professionals to view and to keep up to date too. And it is free to join MS Auckland. If you'd like to stay in touch and keep up to date with our e-news or our quarterly magazine, please feel free to contact us via our website to stay in touch. I can put the link in the comments. Thank you.
Oh, sure. Thank you, Penelope. So we've next got Lynn from Muscular Dystrophy Northern. Welcome, Lynn.
Thanks, Linda. Good morning, everyone. I'm Lynn from Muscular Dystrophy. We provide support for more than 60 different neuromuscular conditions. The conditions are mainly inherited and affect both male and female of all ages, and occur across all ethnic groups. More often or not, more than once in a family. Currently, there are limited treatments available in New Zealand. The conditions can be devastating to those newly diagnosed and their families, and our organisation plays a vital role in providing support and professional advice through our field worker service. This service is provided free to our members and includes home-based visits, support for new diagnosis, referrals to appropriate agencies, advocacy and support, liaising with other services, information and knowledge on neuromuscular conditions, facilitating social contact with others, attending multidisciplinary clinics, annual family camps, regular newsletters and emails. We have a client base of about 809 clients, of which I have 400, and my area goes from Panmure to Cape Reinga, so I can be quite busy some days. Thanks, everybody.
Carolyn. Right, next we have Neuro Connection Foundation. Paula, you there?
Kia ora whānau, thank you for this opportunity. Ko Ola Ioane toku ingoa. My name is Ola Ioane, the new General Manager at the Neuro Connection Foundation. We are a charity that provides rehabilitative care for adults with neurological conditions such as stroke, Parkinson's, and MS. We use a learning process called conductive education, and we've observed whānau that it addresses a holistic approach to hauora, health and well-being, taha tinana, taha hinengaro, taha whānau, and taha wairua. And so we support our whānau with motor skills, flexibility and strength, functional independence wherever possible. We do our best to build communities. And so when people with similar lived experiences, as you all know, they go on a long-term journey together, it creates that sense of belonging. We have new clients. We also have clients who've been with us for 20 years, and we engage in regular self-reflection or personal sharing. And we also set realistic goals for personal development and growth. And our client feedback shows that there have been improvements in confidence, self-esteem, and resilience, and so on. And so at this stage, whānau, we offer 14 sessions a week, $15 for a 2.5-hour group session, or $40 for a one-on-one session. So if you know anyone in West Auckland who is seeking community building focused rehab, you can get more information from our website, flick me an email or call me. I'll paste all of the details in the group chat. Thank you for the space in the 90 seconds. I'm looking forward to getting to know you more. Let's do this together. Ka kite.
Oh, thank you. Thank you, Ola, and welcome to your new role. I know your organisation has struggled for many years to get any government funding, so I hope things change. So the next is Stroke Foundation, Monica. Welcome, Monica.
Kia ora, everyone. So yes, Stroke Foundation is a national organisation. Our work can be divided into kind of two broader areas: life before stroke and then life after stroke. Our life before stroke services is more around prevention of stroke by raising public awareness of the risk factors, as well as we have a van that goes around providing free blood pressure checks out in the community, sometimes just posted up at grocery stores. Otherwise, if there's a larger community event, that we'll try to attend as well. We also provide pulse checks in our van around the detection of atrial fibrillation or that irregular heartbeat, as well as promoting the fast message and advocating for government action. Our main role, especially within West Auckland, is in our life after stroke services. So myself and my colleague Pauline Mitchell are community stroke advisors that cover the West Auckland area. For when a person has had a stroke, we get a referral from the hospital, connecting the person who's had a stroke as well as their carer, whānau, with the support they need to make their best possible recovery and live their best life after stroke. We have sort of different stages of information, support, service, navigation, and advocacy. And together, these services help people who have experienced stroke, as I said, and their carers and whānau, to connect and navigate the other support services that they need to, looking at that holistic. If we can't provide it, who can we connect you to who can? And it's very critical service for people to make a successful transition into managing their own recovery and well-being at home, reintegrating back into the community. We take personal referrals, though, as well as the referrals that we get directly from the hospital. And I'll put our website in where we have a referral form. Thank you.
Thank you, Monica. So last in this long-term conditions section is Kim from Your Way Kia Roha. Welcome, Kim.
Thank you. Good morning, everybody. Yes, my name is Kim Howell, and Jackie Taylor, my colleague, isn't able to be here today, so I'm filling in for her. I work for Your Way Kia Roha Hearing Therapy, and we're a New Zealand-wide service that's funded by Whakaha Ministry of Disabled People. Our services are available free to all New Zealanders aged 16 and over. We provide free and independent support to help people assess and manage their hearing impairment. We welcome support people and families to come along as well, because hearing loss does not just affect the person who we see, it also affects those around them and their workplaces. So we're always looking for innovative ways to provide solutions for people to manage their lifestyle better. We receive referrals from other agencies such as GPs, audiologists, care agencies, and people can also self-refer. Our reception bookings, I'll pop on the list there, is 0800 008 011, and we have referral forms available on our website. Thank you and Merry Christmas.
Oh, and you too, kia ora. So we'll go to the next section is mental health and social services. So if everybody can put their hand up and on that is great. And first, I think Jodie, are you still here or did you have to leave? I think she asked a question before. Can't see her hand, so I think she had to go. So we've got, and she was from Changing Minds, so we've got Michelle Clayton from Family Action. Welcome, Michelle.
Kia ora tātou, lovely to be here to see you all. So those of you that don't know, Family Action provides family violence services and sexual violence crisis services for West Auckland. We've got trained social workers and we've got counsellors and art therapists, psychotherapists. So if along your journey with your clients you find out that anybody needs some extra support, we're really happy to work alongside all of you. We've got new premises. We're on Universal Drive next door to Cream. So if you're wanting to know more and want to reconnect, then please drop in, and the kettle is always on. Thank you, everybody. Merry Christmas.
Thanks, Michelle. So next is Katrina from the Grief Centre.
Kia ora koutou. Hi, I'm Katrina from the Grief Centre. I'm General Manager here. Grief Centre, we're a charitable trust. We were established in 2009 and we offer loss and grief support to anybody experiencing any form of significant loss. So this includes bereavement, relationship loss, redundancy, illness and loss of faculty, perinatal loss, migration, pet loss, trauma and disability. So our kaupapa is to support anyone, regardless of their financial circumstance, to live through their loss. So we provide counselling, we provide ACC, sensitive claims counselling, information and resources. We do bereavement support, so after funeral grief care with funeral homes. We also have professional training and workshops for those who work with people living through loss and do professional supervision and staff support sessions. We're based on the North Shore, but we have 32 grief counsellors based throughout New Zealand, including quite a few in West Auckland, and they can do face-to-face, online or telephone support, and anyone can refer to us either through GPs, EAP organisations, self-referral, funeral homes, other health professionals. So griefcentre.org.nz is our website. If you can to find out more, and we have just moved to a beautiful new space on the shore, so if you're ever this way, please come and visit, and we do have a Christmas tree in our foyer where you can hang memorial decorations this season to remember those that you've lost. So please come and visit and have a wonderful Christmas. Thank you.
Thank you so much. Just a reminder too, we've got our own star trees over here with the Hospice. West Auckland Hospice will be around the place as well, so check that out. So next is likewise we have, is it Due? I'm not sure how to say your name, I'm very sorry. You need to unmute yourself. Oh, just going to unmute here.
Kia ora, it's Jude.
Jude, oh Jude, thank you.
Jude.
We've got that, I've got the spelling wrong, sorry about that, aroha mai.
So anyway, kia ora tātou. So I work for Family Services. We're based in Newland, so most of our services are particularly focused on West Auckland. We are very child focused, and the services that we have, I guess, focus on prevention interventions, looking at supporting and strengthening parenting. And so that we have a number of services that are actually, we are contracted to do some services. So one of them is Mana Whānau, which is a 6-month intensive program. Referrals can only come through Oranga Tamariki, where our kaimahi go into families and they're working when they're at their most stress. So it's not a 9 to 5, it's when whānau actually really need them to be present, supporting families, helping them with routines, helping to manage children and other household things and services. We have a range of toolbox and parenting programs where people just can come through our website and book in to do parenting through separation, building awesome whānau, or other preschool and primary focused parenting programs. So they're about 6 weeks focus. There's a community social work team that I'm the supervisor of. That's generic social work, mainly for whānau in West Auckland. Anyone can refer to this particular program. That self-refer or organisations can do that. Then we have our new whānau resilience program called Tōku Whānau. That's a 12-week program focused on healing and future planning for whānau who are ready to move on from family violence. That's us. Kia ora. I can put our website in the chat box. Thank you for the opportunity to call in.
Kia ora, Jude. Kia ora. Right, we have next is Manalai. We've got Jose and Edward here, so I'm not sure which one of you is going to speak. So
hello,
Jose is unmuted, so it must be you. Kia ora.
Okay, hello. I'm Jose from Manalai. I'm the manager of the youth department. We provide counseling services for boys from 8 to 24 years old. We have 4 different programs. One of them is Boys Alive, is for anger management for kids from 8 to 12 years old, and is a group every school term for 8 weeks. Some of the activities that we have is we go to Parakai. We have a camp 2 days and 1 night. We have the flying fox, rope climbing, tunneling. Yeah, that is part of the activities. So another program that we have is Boys Alive in School that started in term 3 and term 4 when they are in intermediate. So it is to help them to move to high school. Then the last 3 sessions is when they are in high school and to see how is the progress and what something that they need during this process. Another program that we have is Youth General Counseling, that is to help kids in any single area: anxiety, depression, sexual abuse, etc. So thank you. If you need any help, just go to our website, that is manalife.org.nz, and Merry Christmas, everyone. Thank you so much.
Merry Christmas to you.
Thank you.
Is it Feliz Navidad?
Feliz Navidad, yes.
Right. Thank you. So have we got Amy here from Perinatal Anxiety and Depression? No. So we'll go to Robin Hoffman from Real World Living.
I'm Robin. I work for Real World. We're a disability adult service for ages over 16, so 1-6. We are based in Papakura and Penrose, but we have clients that come from as far in West Auckland as Massey into our Penrose site, and we also have the brain is forgetting, but we have people that are not on site that we also support all the way across Auckland. We also have a transition service which operates everywhere in Auckland for people who are leaving school that have a disability. My role is community networking, so I am based all over the place, so I'm not based in one of the sites. We create lots of little libraries for across Auckland, which I've sent through to Linda. We're always after plywood, but 2 of the people that are in this meeting today have got libraries delivered to them as well. So if anyone wants one of those or has any plywood, we'd be really appreciative. We are also after some speakers. So if there's anybody wanting to talk to some of our clients, we've had around about 10 speakers so far. They are absolutely loving people presenting. There's about 50 people, so there've been about 2 groups in our Papakura site, talking about whatever you may do if it would, if it would be relevant to them. But we've had a variety of speakers. So yep, I'll put all my contact details in the chat, and thank you so much, everyone.
Thank you very much, Robin. And if you can just give an indication of what sort of topics you'd like if people wanted to take up that offer. Thank you. Now we're on to community health. So I think we've got 1, 2, 6 more presenters. So if you can put your hands up now virtually. First is Redland, and I can see you right there, Redland. Over to you.
Yes. Thank you, Linda. Kia ora koutou ko retunga tuku ingoa. It's a pleasure to be here among other organizations and communities, and representing the Aotearoa Africa Foundation. We are based in Mount Roscoe. We just moved into a new space from Onehunga, but the people that we serve are all over the city, from West Auckland to East Auckland, as well as South and Central. So AF is a grassroots organization that advocates for New Zealanders' African background, but also migrant and ethnic communities through services and programs, so social services, health and well-being, and social advocacy. And our advocacy rate is about 80% now in terms of like social housing advocacy. And we really engage in direct contact and direct advocacy as well. So in terms of health and well-being, the organization is now also considering, I think I mentioned this last time, we focus on research as well and supporting researchers within the communities, within the African community as well, who are looking at sexual and reproductive health and also infertility, especially within the African community. So infertility is it's a taboo subject as well. Like people don't talk a lot about it, and there's less education, just as mental health. So previously, in previous year, we tried to do a campaign on mental health as well, because both of them are taboo subjects and there's also less education. So, and in terms of infertility, is also one of the 6 most severe handicap amongst women and age 60 and below. So we want to educate the community in order to minimize the stigma and create a broader understanding of its repercussions as well. In addition, also health disparity among ethnic communities as well. As you know, the report from the Ministry of Health reported that there's been health inequity. So we recognize that it's important to acknowledge that social determinants of health influence health outcomes, and therefore it's important to address health disparities and in an ethnically diverse community. So that's one area that we also focusing and putting the resources on. And so apart from the health area, we also deliver social service, food support, and advocacy as well with social housing, and also those in the community with language barrier, educational programs. And yes, in general, that's it. I'll leave the website, and there we also like to collaborate and work with other organizations. But also what we want to do is to be a partner with the health department, so we can get the support, because we don't have the support in terms of like health as well, and even African health services as well. So it would be good if we can get help and support. It's Mr. Danny who is here as well. So I also have a question on that, and how, because we know that health outcomes, social determinants actually impact health outcome, the way people live in the house. If that's why we focus on social services as well, if that's improved, so how can that be included in a new health system where doctors or health professionals can consider or give treatment based also on social determinant?
Thank you, Red. That's great. Thank you for that. I think we can't all help trying, seeing we've got Danny here. And thank you. And you're right, we have a very large migrant community in West Auckland that have specific needs. So next, now, do we have Leah or Darcy from Asian Family Services? Don't see the hand up. Citizens Advice Bureau, Leonie Wade. Haven't seen a hand up. Edith from Maternity Services Consumer Council. Don't see Edith. So what about Te Manawa Connected Communities, Karen Walters? No, so we're actually down to Samuel
There's a
Cho.
comment.
Oh, who we got?
Sorry, there's just
Oh,
a comment from Karen in the chat.
yes. Now,
that
what
she
is
had
that? Sorry,
an
thank
automatic update.
Oh, great. Sorry, it's an automatic update. So if everyone can look there, sorry, I'm trying to manage looking at the participants, the hands, and the messages as well. So thank you for bringing that up. So we've got Asian Network, Samuel Cho. Samuel.
Thank you, Linda. Kia ora koutou, good morning. Still morning, right? So I'm Samuel Cho, I'm the manager of the Asian Network. We are committed to promoting health and well-being, particular of the Asian and migrant communities. Meaning the lots of the health seminars that we provide of the whole year. So where we more focus on the prevention and also raising awareness of health. And also so we promote your service for those who might not aware of your services. We have a small team as well who can provide a social support service for those in hardship. Please let us know and we'll see how we can help out for those in hardship, in particular the ethnic community background. Now we are calling the contents for our summer newsletters. So if you have any good story to share, and then some cases works very, very well, and also the message that you like to promote health and safety issue relevant to the holiday and the festive seasons. So you're all welcome. In addition to our service, the broad network with the Asian community and Asian service providers are our asset. So which means that we can help out your client, your team, who need some kind of support or cultural or linguistic support for your clients. Just let us know, and we can provide a network, and then also we can introduce some of them who can provide the service to you guys. So yeah, that's it. And thank you, and wish you a Merry Christmas and Happy New Year.
Thank you. And Samuel, you have your first little grandchild, first Christmas. So that's lovely.
Thank you.
All right. So we're going to, we've got a bit of time up our sleeve. So I'm going to ask Edward from Man Alive. He had something to say. About adult. Sorry? About adult program rather than the youth programs. Welcome, Edward.
Kia ora. Edward Meyer from Man Alive. We run non-violence programs and general counselling services for men and, as Jose mentioned, youth from East Auckland through to West Auckland and up to the far north. Our main office is in Henderson, and we have offices in Panmure and Orewa, and also in Whangarei, which serves satellites throughout Northland. We see a lot of men with relationship issues and some involving family harm. So our programs, our non-violence programs, are free and they run for 20 weeks. And we run about 11 programs per week in Auckland and another 4 up in Northland and throughout Northland. We have a part charge for counselling of $60, so we can do individual non-violence programs or general counselling, and WINS will cover that for some of our clients. And we work with issues mainly to do with relationship distress and separation, and depression and anxiety are really current issues, and financial matters. We have social work support for our whai ora as well, to help with some of those issues alongside the more personal issues. So that's enough for me. Merry Christmas. We close on the 22nd of December and we open again on the 8th of January. And we have a new website and a new T-shirt.
Okay. Yep.
So,
Okay, thank you, Edward. Thanks very much. Merry Christmas to you too. So we've also just Leomi from Citizens Advice Bureau has just come on, so we've still got a bit of time. So Leomi, over to you.
Kia ora. Hello, folks. Obviously, I hope that you've all heard of Citizens Advice, and we've got 5 branches across West Auckland. I'm really here just trying to find out about all of you guys. However, also would like to make sure that you know where to send brochures, pamphlets and things like that, so that we can highlight your organisation when we need it. And so if you send it to the Glen Eden branch, I will put up the email for our information officer. So you can send it to one place and she then sends out to the 5 different branches to save you some time. Obviously, we deal with a myriad of problems. So should you have some people who have got complex issues, you can sort out some of it, but you don't actually know where to send people with the other stuff, please then send them to us and we will do our best to connect them with the services that they need. That can be immigration, that can be employment, that can be tenancy, whatever. We will always endeavour to find translation. However, we have only got a limited service of translation. If you know more people with translational skills, we'll take that too, because we do have a wide community with a broader range of languages, and we're trying to support as many people as possible. So I've been taking notes this whole time. Your organisations are all awesome and fabulous, and please let us have information and make sure that your organisation is being highlighted by the Citizens Advice Bureau. Thank you.
Thank you. And thank you to all your service is purely voluntary. So just want to acknowledge the work all your volunteers do in our libraries and centres. So that's the end of that. But I wanted to give Danny a chance to just give any feedback he wanted, seeing you've been having a listen. You can probably hear, Danny, that it is quite local and yeah. Did you have any comments or any questions you had around our presentations?
Thanks. I'm heartened by the diversity of services that are available locally, and the passion that all of you have got. I mean, everyone's so dedicated to their organisations and their communities. It's heartening to see. I'll just people are asking, probably thinking, how do I get more of a slice of the action in terms of getting on the radar? Because I'm conscious that big providers get all the airspace and smaller providers don't. And so that is something we are thinking through around how do we get the smaller NGOs as part of our local conversations. And that's the whole point about having more locality-based staff, people on the ground who can actually do that. Because you know it's going to be impossible to get hold of me all the time, because I just won't have that time. But there are people who in my team who will be redesigning services, and then people engaging with localities, and then the trick for us is how we bring that together.
Thank you, Danny. And I think that's the thing is we started out this forum as a forum, and we went into the hospital, set up tables, and different organisations went so we could connect with the health providers, our nurses and doctors in the hospital, so they could see what was available for their patients. But actually the serendipitous or sort of upside, the silver lining of COVID is that we've developed this forum now, and so many more organisations join together and hear about each other as well. And we've found that a reasonably effective, and that's why we've continued it, because it means that some of our hospital staff, some of our PHO staff can actually just pop in and listen to this rather than getting in their car, coming to the hospital and trying to find out, and also the CAB. So I think we've tried to be a conduit for that voice for our community. And so, yeah, we hope that you keep, you know, using this, you know, connected to this network, or your advisors do. And absolutely, we know that you can't be out doing this. You've got to conduct the orchestra, and hopefully you'll be able to get your people on the ground quite soon, listening to us. So we really appreciate that, and thank you again. So what we're going to do now is we have Paula Seymour here, and this is one of our little spots we have, Danny, is Paula Seymour, our General Manager, Child, Women and Family Division and Site Manager for Waitakere Hospital, is actually ex officio on our board now, because we used to have a DHB member ex officio. We changed our constitution so that we'd have some link back to the community, and also that they can hear what's happening. And so Paula has been absolutely amazing, and we've been very grateful to her to giving us our time as a community. So I'll ask Paula now to give an update. Welcome, Paula.
Kia ora koutou. Thank you, Linda. It's lovely to see you all as always here. So we've had some really exciting things happen at Waitakere Hospital that I really wanted to share with you, and one of which is the commencement of the building works for Manaaki Hohonu, which is going to be the new ICU and medical ward at Waitakere. It will take a few years to build. I've at many times over winter thought we need this right now, but it's really exciting that it's started, and it's starting at the back of the hospital, close to the ED, but in the staff they've taken over some staff parking area, and we'll have a new roadway around the back of the hospital. So it's really exciting. And of course, in February, we'll be starting building our primary birthing unit, which Waitakere HealthLink and the community have been amazing at helping us get up and running. So that will take about a year, so less time than the ICU and medical wards. So potentially this time in a year's time, we'll have something really significant to celebrate. But as with all facilities work, I won't count my chickens until it happens. Just on facilities, there's quite a few things going on at Waitakere. We're doing some upgrading of our birthing suites, and I've been in there today. It looks amazing. So that will be upgraded, and we hope to open those sort of in the middle of next year. We're also doing some work in the Wainamu ward, which is where we have a COVID area, and just making sure the environment is more pleasant and up to infection prevention control requirements. So these works have delayed a little bit the work that I know I would be asked if I'd opened it up around the front of house. We've just had to prioritise the work that the constructors are doing, but I do expect that to start off. We're just choosing some furniture and ensuring that keeps in line with our other areas of the hospital. But we have had some discussions on how we can use that for NGOs coming into the hospital and being able to share with, which we talked about at the AGM, share with visitors and patients. So that will be an exciting thing for next year. The other thing we've got right at the moment is an echocardiogram. We've got a van at the front of the hospital, so that's giving us a bit more capacity for to enable people to get diagnosis earlier. So there's a lot happening at Waitakere. I've been fortunate enough to move back into my old office. We had some damage to one of our buildings in the 27th of January floods, and we're now moving back in, which is fantastic news. So some really exciting things happening. We hope we have seen an uptake in COVID over the last few weeks. So as people get out and celebrate, we are still recommending that people wear masks within the hospital. The air handling at Waitakere isn't quite as good as some new facilities, so you may see differences in Auckland Hospital versus here, but would recommend that as well. But that was about all I wanted to update. Are there any questions that I can help with?
Anyone got a question? Seen any hands up? I think your great regular updates help sort of keep us up to date. That's great. So thank you, Paula. We wish you, I hope you get a little bit of a holiday. You've worked very hard this year and stay COVID free. But thank you so much. So what we're going to do now is we're going to go on to Erica Fairbank, who developed the community support brochure with Tracy here from HealthLink. Erica, are you here?
I am.
Thank you. Welcome. Welcome.
Open my video so you can actually see me.
Right.
And that's not working. Okay. Anyway, here we go.
Here we go. Hello.
Thank you so much for inviting me yet again, and hello everyone. It's nice to listen to all the NGOs out there. So a little bit of background. I'm Erica from Patient Experience. I'm a nurse from background, but I also worked for an NGO myself for 3 years. So I'm trying to sort of bridge between the healthcare professionals and the NGOs. And I had great help from Waitakere HealthLink with creating a leaflet, which is Waitakere and North Shore NGOs in here. And some people might have seen that. I know that most of you are in there already, but I think I've noticed 2 that are not in, that I heard a talk from this morning. So the leaflets are still very popular. We went to all the charge nurses in both hospitals, explained to the staff what's in it, when to use it for the patients, and they can order their own. There are a couple of places like front of house where they can't order leaflets, and I quite often pop over and see how many they need, and they're always gone. So they're really, really popular, which is great. So I wondered if I could send another PDF and a QR code for how it looks like now. Obviously, with the QR code, I make changes as I hear emails from NGOs. And when you use the QR code, those changes are immediate. With the handouts, that's not the case. So we have a couple of slightly older handouts. And so this is a good time if you think you're not in the leaflet, but you would like to be in it, or you know of an organization that should be in it, please email me. And because next year I will update the handouts as well with the updates, and we distribute them again. So thank you very much for inviting me, and I hope
Thank you, Erica. Yeah, and if you just pop your email, I think pop your email on the side there. So if anybody thinks that knows they're not on there, or even the link to get to it, so or the QR code, so people can see if they're there, and if they're not there, let you know. And I think you've taken some notes, so that's great. Now, I just note that Karen Walters from Te Manawa Connected Communities is back online. We've got time to give you your 1.5 minutes, Karen, if you want to take it. Is she there? Oh, there we are. Karina.
Yes, please. Morena. Thank you so much, Linda, and thank you, everybody. I'm a bit new to this group, but so we have many community hubs across West Auckland. Te Manawa is one of them. We're located in Westgate. We have a beautiful facility. We see some of you already in our facility doing pop-ups and things, which is fantastic. I also lead a network for basically Massey, Westgate, West Harbour, Hobsonville, right across the area of other community service providers, such as our food banks, etc. And there's been a strong recommendation from them that if we could have some type of ho-order day at one of our community hubs, whether it's Te Manawa or anywhere, I'm really not bothered. But it's really what they're saying is that the community desperately needs it. They would like to have the opportunity to have access to so many of the wonderful services out there, but perhaps in one place on one day, just to make it easier for them. And of course, because I work right across West Auckland and our community hubs, etc., if anybody wants to do any pop-ups, or if you have any, just seen the wonderful pamphlet that we were shown just before, anything like that, I can get those distributed out to any of our library spaces and community hub spaces as well, so that community can find that information. Other than
Thank
that,
you.
thank you so much.
Thank you. And so you're part of its council, right?
Yeah, it's part of council, absolutely.
Yeah.
But the service providers network that that I'm helping to facilitate at the moment is everything from churches right the way across. So yeah, happy to represent either.
Oh, thank you. Thank you very much. So, so where we're at now is we're right near the end. I want to thank everybody for their amazing contribution today, and in fact all year, and in fact just for everything you do for our community. You're extraordinary people, and I don't think you get thanked enough. So thank you from us here at Waitakere HealthLink. One of the things we're going to be doing next year is we're really keen to do a youth mental health forum, possibly in this media or possibly in person. So if anyone working in the youth mental health space is keen, please email Tracy at HealthLink, because we're going to pull that all together. Our youth representative, Samantha Satayanan, actually Santayana works in this field herself at Odyssey, and she's really keen to do this. So we'll put more information out about that. So to finish off, I just want to do a karakia whakamutunga. So kua mutu a mātou mahi mo tēnei wā, mana akatia mai mātou katoa, o mātou hua, o mātou whānau, ai o kia te aorangi. And Merry Kirahimati, Merry Christmas to everybody. Thank you. Bye.
Merry
Take
Christmas,
care.
everyone.
Yeah, have a great break and all be safe and have fun.
Thank you, Linda. You have a good day.
Okay. Thank you. Bye.